Croatia is banking on its scenery.
That its natural beauty will be the first thing to come to mind.
The Dutch are offering a home from home.
We also have a very stylish Queen and enjoy fish and chips.
While the Swedes are stressing their scientific heritage in a competition that feels more like an Olympic bid in the contest to host the European regulator that may be the biggest casualty of Brexit. The European Medicines Agency has been based in London for more than 20 years, but the regulator, which licenses drugs for 500 million patients across the continent and oversees a £200 billion industry, has to move. Among the 19 cities that think it's a prize worth winning is Dublin, which is offering a new home on the waterfront.
The economic benefits to Dublin and Ireland would be absolutely massive. It's a very large agency, 900 direct staff, but also much more than that. Having the EMA located in your country very much brings a focus on medicines and the production of medicines to the host country. So there are many, many spin-off benefits to Ireland domestically. But this is one of those times where what is good for our country domestically is also really good for Europe.
Britain may be turning its back, but Ireland's bid reads like a love letter to the EU, backed by hard cash.
The Irish government is offering more than £70 million in incentives to host the EMA. They're even talking up the lifestyle benefits of living in Dublin for staff who relocate. And one of the reasons is they believe it will help put Ireland at the front of the queue for new medicines. Back in the UK, however, there are concerns that British patients may pay a price.
Hosting the EMA has helped the pharmaceutical industry thrive. Eisai is a Japanese company that has its European headquarters in Hatfield, from where this epilepsy drug is sent across Europe under a single licence. That makes Britain an attractive place to develop new drugs, and patients have benefited from access to new treatments. That may change if the UK has to have its own system of regulation.
Obviously, from Brexit itself, the risk is that there may be supply shortages unless we carefully manage that transition period. And then on the other side, we want to see the UK arrangements sufficiently developed that we don't find the UK is in what we call the second or third wave of submissions.
The government says it wants to continue collaborating with the EMA, but has not explained how it plans to retain access to the market without being subject to European regulation.
As things stand, British-based pharmaceutical industry is going to be paying more to do what they're doing today.
Correct. We will be paying more for what we're doing today for no added gain.
A final decision on the EMA's new home will be made in November. The prognosis for British patients and a £60 billion industry will take longer to become clear. Paul Kelso, Sky News.